So before evaluating Mr. Jones, the things that I would need from the medical record would be to kind of determine if his oxygen transport and cardiovascular health is stable enough to tolerate activity safely at this time. So first, I would review all of his vital sign trends. This would include heart rate, blood pressure, respiratory rate, oxygen saturation, and mean arterial pressure over a period of time, and see if he's stable enough. And this is just because when we're mobilizing Mr. Jones, it will increase his oxygen demand as we're mobilizing him. So these will help me to understand if he is stable enough to tolerate activity without causing him to significantly have physiological stress. Secondly, I would like to review his ventilator settings. This would include like the FiO2, PEEP, respiratory rate, tidal volume, and this stuff will give me an idea of how much respiratory support he's already currently requiring, which will give me an idea of how he will be during mobilization. Thirdly, I also want to see his lab values, including the most important ones that I would like to mention are hemoglobin for oxygen carrying capacity, his white blood cell count, though I expect those to already be high. I would hope that his trends on that would be that they are getting better, and then also his platelet count to identify any bleeding risk that he might have before mobilizing him. Fourthly, I would like to have an idea of his current neurological or cognitive status, as this will tell me like the level of sedation that he's having, as well as the alertness and his ability to follow commands, because this is important as we're going to be mobilizing him. I want to be able to understand if I can get communication from him in some sort of way to understand if symptoms occur during movement, as well as to keep safe in general throughout movement. And lastly, I would like to ask nursing or any other individuals who have worked with him how he has tolerated certain interventions that they already were performing with him, such as positional changes like rolling, sitting in bed, and what positions he's been in. This kind of gives me an overall idea of his cardiovascular and respiratory system responses to movement that has already been performed. And other than that, I would want to identify any lines, leads, and tubes before going in.